Welcome back. Well, next week will mark the end of Breast Cancer Awareness Month. And even though we recognize it throughout October, it's important to be informed about the issue all year long.
Yeah, it sure is. And here with some helpful tips is Dr. William Owens. He's the director of Aurora Baycare's Comprehensive Breast Care Center. Good to see you. Thanks for joining us.
Morning. Happy October.
Happy October. You're supporting the Pink Breast Cancer Awareness Month. This is such a huge topic for everyone to be talking about throughout the country. So let's get right to it. What are some screening recommendations that you have for women to be aware of?
I think women should realize it actually starts at a young age, so at age 25, because there are a few patients who have a gene mutation that can run in their family, the so-called Angelina Jolie mutation. So even at age 25, women should be aware if they have a very significant family history of breast cancer. They may want to speak to their provider and possibly have genetic testing. But even at age 30, then, we begin to think about possible screening with such things as mammograms. And so patients can meet with their provider again, and they can actually create a calculation where they decide, is a patient in an average risk category or in a high risk category? So really learning how much of a risk a patient has is important to then decide how they should be monitored. And then for the average risk patient, we suggest following the American Cancer Society guidelines for surveillance. And that means that beginning at age 40, the woman should begin to consider having a regular mammogram. Certainly by age 45, she should be getting a mammogram every year. At age 55, if she's had good, clean mammograms through those 10 years, then it could possibly go down to every other year. And then it's important for the woman to be aware that she should be monitoring her own breasts, because about 45% of breast cancers are found by the woman herself. So she should be aware of any lumps that she might have in her breast, any skin changes of the breast, if the skin dimples in, or if she has any spontaneous discharge from one of the nipples. Those are really the three signs that we ask patients to watch for.
And knowing your body is, like you just said, so important. We were talking during the break about some of those statistics as we've made great strides in breast cancer research, but it is still such a prevalent disease.
Yeah, it is. In the years since I've been in this field, we've gone from doing very large, very deforming type surgeries to operations now where we can just make small incisions. We don't have to remove as many lymph nodes. But still, very once in a while, we get a patient who has a very aggressive breast cancer, and it can be very challenging. And the earlier we catch those aggressive ones, the more likely we can still cure those.
And for someone who may be diagnosed, what are some treatment options out there?
Yeah, so usually patients start with surgery, but for more advanced aggressive breast cancers, we're now learning that if we start with chemotherapy, we can actually sometimes shrink the tumor, make the surgery easier on the patient. But now in most patients who have breast cancer, we don't need to do a full mastectomy where we remove the entire breast. We can do lumpectomy, we can leave the breast in a very cosmetically pleasing fashion. And then we're doing much less lymph node surgery than we used to do. Women used to require large numbers of lymph nodes to be removed. Now we can usually just remove one or two to find out just how significant the disease is. And then finally, at Aurora Baycare, we've got a program now where we're offering many patients to do their radiation therapy in the operating room. So they just receive one treatment of radiation rather than have to go through 3 or 4 or even 6 weeks of radiation afterwards. So there's been a lot of improvements in the techniques over the years.
Great to see those improvements and advances, but we really need to concentrate on this all year round, right? Not just the month of October.
Yeah, we love October because it brings awareness to the disease. We know that there's more women that get their mammograms in October and do those self-assessments. But certainly the disease can appear at any time of the year, and the earlier it's discovered, the better the patient is likely to do.
All right, great tips from Dr. William Owens with Aurora Baycare. We appreciate the time this morning, keeping us aware for Breast Cancer Awareness Month and what we should be looking for really all year long. So thanks a lot for joining us. We appreciate it. You gotta check on the forecast right after this. Stay with us.